versus ending up in the judicial system, because that's where they were ending up, in jails.
The Escambia Sheriff's Office following through on a promise to change the way it responds to mental health calls. Sheriff Chip Simmons introducing a co-responder unit, a deputy and a clinician from Lakeview working together to reduce jail population and break down barriers for help.
WEAR Samantha Servant spent a day riding with this the first team to hit the streets, and joins us now in the studio. And they say passion and patience are important tools.
We first told you about the idea of a co-responder unit last year, but just this month, Sheriff Chip Simmons pumped up the program with 2 more teams. Now, to give you some perspective, when the deputy I rode with says the co-responder program launched about 5 months ago, she's only had to arrest 1 person since then.
Sheriff's Office.
That's Deputy Joan Savage. In addition to the badge and belt, she has 20 years of law enforcement experience.
Car T12 Cutterfield.
Her co-pilot.
Hey, good morning. It's Paula Matthews. How are you?
A licensed mental health counselor from Lakeview Center.
We still have to lay eyes on you and see you.
Together, the pair was the first co-responder mental health team launched in Escambia County.
And I've had a passion for this for a number of years now, because I knew that there was a need. I knew.
Research from the Department of Justice indicates an estimated 2 million of the 13 million jail admissions each year involve a person with serious mental illness. The co-responder program aims to change that.
I wanted to see people receive the treatment that they needed versus ending up in the judicial system. Haven't I spoken to you once before?
Spending time with people.
How's everything going?
Following up.
It's the continuation of services that we provide.
And getting them help.
You're not going to jail, you're not under arrest.
Beyond lowering the jail population and diverting people who don't need to be there in the first place, this allows patrol to focus on more emergent calls and proactively try to prevent tragedy.
A black female was on the corner, was staring off into space. So they called us to say, hey, can you get out with her and see what's wrong with her?
We saw that firsthand as the team spoke with a young woman outside of Burger King.
What's going on with you right now? Because I see you're spacing out. Have you heard voices, seen things that were not there? Any homicidal ideations? We want to make sure that in this state that she gets help. They can walk into traffic not really wanting to, so we want to make sure that she's safe.
Breathe, it's okay.
Figuring out how to best help people is just one way this team makes the community safer. So whether it's safety or sanity, these co-responder units benefit all, from bystanders and families to the folks being focused on.
You don't have to be embarrassed about it. That's what I do. I do this every day.
Some people may ask, why don't we just send social workers in the first place to these calls? Well, clinicians aren't immune to violence. In Dade City, 2012, a patient stabbed their caseworker to death. And in 2020, Melbourne, Florida, a man shot and killed a social worker outside a mental health facility. Now, these mental health calls don't always escalate to those levels of violence, but by having both a deputy and clinician working together, they're hopefully going to be able to keep things from getting that far in the future. And if you want to know more about how this program started and how mental health is being treated inside the department, head on over to our website and click on this story. In studio, I'm Samantha Servant.